Hello, everyone. Today, my team and I will be discussing the role and the specialization of what critical care nursing is. We will explore what it means to be a critical care nurse and the specialized skills that are needed in order to thrive and succeed in this role. We will also discuss the tough challenges and the emotional toll that comes with this job, but also the incredible rewards and impact that these nurses can have on their patients and also their families during times of distress. My team and I think that it is very important to take a quick but insightful look into this vital field of healthcare, how it positively impacts everyone.
What is critical care nursing? According to the article, What is a Critical Care Nurse by Western Governors University, critical care nurses, also known as intensive care unit ICU nurses, are nurses who work in intensive care units, trauma centers, and emergency departments, mainly within the hospital setting. They provide advanced levels of care to patients with complex and intensive care needs, as stated by American Military University. Additionally, Dr. Stacy Malinowski from American Military University, in her 2024 article titled, What Does an Intensive Care Nurse Do and Is It Stressful?, states that when compared to other types of nurses, critical care nurses typically have far less patients per shift, as their patients typically require more frequent and more complex and time consuming care. What are the specialized skills of critical care nursing? According to the 2024 article titled Mastering ICU Nursing Essential Skills and Competencies, written by Nurse.com, the specialized skills of critical care nursing include having strong observational and advanced patient assessment skills, including vital signs monitoring and interpretation, neurological assessments, cardiac assessments, respiratory assessments, hemodynamic assessments, skin and peripheral assessments, and renal and gastrointestinal assessments. Additionally, critical care nurses must have medication administration knowledge, including pharmacology knowledge, dosage calculations, and intravenous IV therapy. They must know how to titrate medication in order to help the patient maintain homeostasis while in bed, according to the American Military University. Moreover, according to Nurse.com, they need to have proficiency and certifications in advanced life support techniques to manage respiratory and cardiac emergencies such as basic life support, BLS, pediatric advanced life support, PALS, neonatal resuscitation program, NRP, and advanced cardiac life support, ACLS. Critical care nurses need to understand the principles of mechanical ventilation and hemodynamic monitoring. Finally, as stated by the American Military University, critical care nurses must have effective communication, collaborative, and interpersonal skills, as critical care nurses typically work within a team and with patients and families. Now that I have discussed what critical care nursing is and the specialized skills that go along with it, Derek will be discussing the challenges and emotional impacts of critical care nursing on nurses.
Working in the ICU can be one of the most mentally taxing and difficult specialties of nursing. Along with the usual difficulties that come with other nursing specialties, such as burnout and exhaustion, critical care nurses are especially subject to a greater deal of emotional impacts due to the high-intensity nature of caring for the world's most critical patients. An ICU-specific difficulty that many nurses may face is a difficulty in communication. Patients in the ICU face the highest degrees of help, and with this, families are among the first points of contact. Families or other close loved ones may have difficulty understanding and accepting the critical conditions of the patient. Procedures in the ICU are incredibly complicated, and because of this, patients and their families can express a multitude of complex emotions, such as fear, anger, and sadness. This, tied with the fact that critical care nurses have to absorb and handle all of this, can make the specialty incredibly taxing. Next is simply the stressful nature of working in the ICU. An article titled Job Satisfaction Challenges of Nurses in the Intensive Care Unit, a qualitative study, analyzed the perspectives of ICU nurses. One nurse expressed that, I always feel the shadow of death in the ICU, and this feeling of the closeness of death makes me stressed. ICU means the permanent presence of death. Many of these critical care nurses have experienced a condition called compassion fatigue, or secondary traumatic stress. A traumatic stress response in which an individual is significantly affected by someone else's trauma, such as a patient's death. The environment of constantly working to keep a patient alive through long 12-hour shifts, only for some to die, can be emotionally draining and impact health workers significantly.
Critical care nursing is both challenging and deeply rewarding. One of the greatest rewards is knowing you make a direct difference in patients' lives during the most critical moments. You're there when seconds matter, and your actions can truly help save lives. Another reward is advanced knowledge and skills you gain. Critical care nursings become experts in using life-sustaining equipment, interpreting complex data, and making fast, informed decisions. This creates confidence and strong clinical ability. You also experience strong teamwork. In the ICU, nurses work closely with doctors, respiratory therapists, and other professionals. This collaboration builds trust, support, and a shared sense of purpose. There's also emotional fulfillment. You're often a calming presence for patients and families during some of their hardest times of their lives. Being able to comfort someone or advocate for their needs brings a unique kind of satisfaction. Finally, there's professional respect. Because of the intensity and complexity of the work, critical care nurses are highly respected in the healthcare community. Let's talk about the impact. The impact of critical care nursing starts with improved patient outcomes. ICU nurses help prevent complications, respond quickly to changes, and often play a key role in patient recovery. They also support the emotional and mental well-being of patients and families. By communicating clearly, showing empathy, and being present, they help people feel seen and understood, even in crisis. Many critical care nurses contribute to education and innovation. They mentor new nurses, lead safety initiatives, and help develop better practices for patient care. In short, the impact of critical care nurses reaches far beyond the ICU. It touches lives, strengthens teams, and helps shape the future of healthcare.
Like many nurses, other critical care nurses need empathy, strong communication, and mostly resilience. Intensive care nurses have less patience but apply more frequent and time-consuming care. And one of the stronger challenges the nurses will face is death and how the family responds to it. Critical care nursing is literally a life or death profession, but fulfillment could be as a reward of helping others. So, critical care nurses are not only a crucial part of the healthcare system, but the greater society.